You.
I am. Thank you very much all for coming. We are Medequip. My name's Greg McQuillan. I'm Business Development Manager. The title of our talk is Bridging the Gap Between the Private and Public Sector, and I'm just going to kick off explaining a little bit why we're qualified to host a talk of that title. I'll start, if I may, with a statement, which is a fairly bold one. We are proud to be the industry leaders in the provision of community and care equipment, including simple and complex aids for daily living. As you can see here, those are some simple and complex aids for daily living, which I'm sure you're all familiar with. So Medequip provide community equipment services on behalf of Health and Social Services. We store, deliver, install, maintain, collect, decontaminate and recycle all the equipment. Importantly as well, we also procure the equipment on behalf of the social services. Ongoing communication is key at Medequip with OTs, physios, commissioners to constantly enhance and personalise service delivery standards. Now, to qualify my opening statement, here's the stats. We currently operate 42 contracts in the UK. We have 16 locations, from Stirling in the north, very north, to Taunton in the south. We employ over 490 staff. We have over 300 vehicles on the road. Most importantly, in terms of the end user, the geographical areas we cover include 14.5 million people. So that's potentially 14.5 million people that may at some stage require help to live at home or some sort of aid to daily living. Also, with that in mind, we make 500,000 calls per year. That's 500,000 trips up the garden path to install grab rails, deliver the commode, deliver the care package, or deliver the hospital discharge. So we stock 100,000 items and we cover about 1,000 stock lines. Here are the services that Medequip provide. The CES service, which is our bread and butter, the 42 contracts. The clinical services, which my colleague Rob Padwick is going to talk a little bit about in a second, so I won't tread on his toes. Continence services, we deliver in a timely fashion, working again with OTs, clinicians on delivering continence. Handyvan services, including security checks, police security checks from referral, fire security checks, installation of key safes and things like that. Every bit of equipment that leaves Medequip is also maintained and serviced by us. That's planned preventive maintenance. It can also be Lola tested in the community or care home setting, and PAT testing as well. Minor adaptation work at each of our 16 depots. We have a workshop. We bend all our own galvanised rail so we can do bespoke solutions for access to people's houses, all very bespoke. Pressure care, advice, clinical assessment and timely delivery. Our procurement service. We currently purchase around £25 million worth of equipment a year. We're not manufacturers, so we're not tied to one supplier. But off the back of that, we can offer very attractive trade prices to online retailers, mobility retailers, and the private sector. So we're bridging the gap in terms of pricing. What we gain from the public sector, we can pass to the private sector through retail and wholesale. Telecare, also on a number of our contracts, we deliver telecare packages for patients from very simple aids, might be a bed shaking alarm clock, right up to a complete package of remotely controlled telecare. And wheelchair services. But what now? What else can Medequip do off the back of all this? Well, we're looking at the private sectors. Self-funding is a buzzword you hear a lot. How can we help the self-funder? Clinical assessments, that's a handsome chap in that picture there. Clinical assessment, is there something else we can offer? There is. Also, obviously, the procurement services. Mark and Rob are going to take a bit of time to tell you a bit more about those things. So thanks very much again for coming, and I'll speak again at the end. Mark Warburton.
Just while you're getting to the podium, there are some seats nearer the front for people who are standing at the back.
Thank you, Greg. My name is Mark Warburton. I've joined Medequip to deliver the services that we already bring to the public sector into environments that would also benefit and share synergies with. A quick overview of how we see the sector today. In a recent article by Laura McCardle on carehomes.co.uk, reference was made to research showing a 12% decline in the number of UK care homes. That's an additional that's a reduction of 12% year on year. Blame is at the local authority cuts and funding reductions having a negative impact on referrals. 2015 will also see a further reduction of central government funding by an estimated 11 billion. This to be confirmed on the 26th of June, further reducing local authority spending directly. The overall instability of the housing market as a whole is still preventing the levels of investment required to reignite and stifling growth across the board, leaving a shortage of properties to satisfy an increasing demand. With an ageing population and an outdated welfare system that is non-representative of the UK today, the care market is becoming too much of a generic term. The many variations of classification, funding, service requirements and dependencies make it very difficult to manage effectively at local level. This compounded by cuts to staffing, further anticipated central contribution reductions and a shrinking resource. 40% of the market remains as privately funded, though this is not to say that 40% of residential care customers actually fund themselves. In fact, more and more local authorities are opting to direct would-be residential care customers into supported living environments. Commissioners are attracted to a greater level of independence and personalisation, and this carries over to their choice of residential care facility when opting for the more traditional environment. With less effective revenue per bed when publicly funded, a relatively high fixed cost base and a glass ceiling when it comes to private rates, a provider's ability to manoeuvre profitability to maintain, let alone improve margins, whilst maintaining standards, retaining quality staff and keeping occupancy rates high is a daunting, if not impossible, task. Some provider views. It goes without saying that if revenue streams are constricted, pretty soon the resulting lack of inward investment will start to have a detrimental effect on the quality of outcome. A business will look to reduce costs, whether to appease investors or simply to remain viable. The consequence of cost reduction normally presents itself as a manifestation of short-termism, i.e. distressed purchasing or just in time. It's not necessarily suited to a service industry to take that approach, where buying in small quantities to preserve cash flow means either paying a higher price, opting for a cheaper alternative, or offering a restricted choice. Enhancing the quality life of the customer is the end game without doubt. Extra care environments submit themselves to this ethos fully and represent self-contained, self-supporting and to a degree self-entertaining communities, with the knowledge that clinical care is there if required, but tucked away in the background. However, moving responsibility for care into the community does not sit so well with providers. Completely understandable considering the impact on a historically buoyant market, and in many ways it is a compelling argument. How easy has it been for care workers to get out to people over these last few winters? What if the individual in question can't afford to put the heating on? What if their usually highly reliable neighbour is taken ill and can't get to the shops for them? All perfectly reasonable and logical concerns that can put someone at the kind of risk that simply wouldn't be there in a managed environment. Clearly, any provider will look to enhance or improve their environment and in turn the experience provided. Improving skills, increasing occupancy and becoming attractive to a wider audience are all pretty obvious targets to reach. Obvious, yes, but are they achievable? How we see the bridge. Medequip have built a reputation through consistently delivering a high quality, cost effective and innovative service to public sector clients across the UK that has enhanced the experience of service users to levels previously unattainable. Making the most of our experience, of our depot network, our IT platform and the most inclusive range of products from all major manufacturers in the industry, Medequip is now extending its service to the wider healthcare sector. Not being a manufacturer and therefore without the pressure to support and promote its own manufacturing base, Medequip is the single largest independent procurer of equipment in the UK today. Cost efficiency created by this buying power is significant, and in these extremely challenging times for all care providers, with changes to regulations, greater financial instability, and increasing overheads, managing costs more effectively must be the #1 commercial priority. The value Medequip has brought to the public sector translates perfectly to the private. An easily accessible single-source supplier with a national capability, a web-based ordering and performance monitoring program, a wide and inclusive product and service range, all delivered in an ultra-competitively manner. So, in terms of how this translates, of course there are any number of companies who will happily provide you with your beds, mattresses, hoists, etc. But this is where Medequip take it up to another level. How many suppliers does it actually take to support a care home? What if there is just one supplier who were capable of managing your continence service, who could not only service and maintain your equipment but keep your PAT and LOLA obligations covered? What about product training? What about signposting? What about a loan store service so a wider range of referrals can be safely accommodated without the need to dip into capital budget? The reality is all of this is part and parcel of our daily lives. We do this across over 40 contracts up and down the country. We're also actually very good at doing it as well, not just in terms of quality but in terms of savings. On average, our contract delivery comes in at somewhere between 20 and 25% less than before Medequip ran the service. This saving can be translated to a small home with just a few beds or a national operator with thousands of beds. A common requirement of all of our contracts is the need for visibility. Transparency and accurate information comes with that. Working with our partners, we developed a system called TSIS that would be the central point of the many and varied resources necessary to successfully deliver a CES contract. As a tool, TSIS is the shop window for commissioners and prescribers alike, providing access to the stock inventory and the ability to order, special delivery information such as in the case of an emergency hospital discharge, times for delivery, in fact anything to do with the person at the heart of the service. All equipment carries a unique barcode which gives a full description including make, model, service history, everything required to identify that specific piece of equipment. Not only is this critical to the status of the equipment, it's also vital to be able to identify any equipment in the situation where there's a BHTA product recall. Because the system itself is strictly controlled through the use of scanners, it's very easy to see exactly what is going on across every element of the contract. Our clients have the depth of visibility to see how every single element of the contract is being delivered, all in real time and accessed online. Different groups within the organisation have different needs when it comes to information, and to this end, reports are created by the individual to show exactly what information they want. For example, a lead commissioner needs to keep an eye on the financial side of things and can therefore see exactly who's spending what, where and on what. TSIS provides every scrap of information direct to the commissioner and in predetermined formats or timescales, but on demand and showing exactly what's going on, warts and all. The level of transparency and openness is reflected in our customer satisfaction. Our rates are consistently over 99% across all areas of our contracts. What makes this particularly satisfying is the knowledge that the KPIs on which they're based are set and monitored by the clients themselves. So the big question, to remain competitive today, any business will be constantly reviewing what it does, how it does it to find areas where improvements can be made. It also needs to engage and listen to what its customers say and what the marketplace demands. Our success hasn't come about by accident. We haven't achieved because others have failed. We've raised the bar time and time again, and for us, the drive to be the best at what we do is also a healthy nod to our competition, because if we don't do it, they will. So for those of you running homes, in whichever form that may be, Medequip will share with you all the lessons and learning from public sector experience to deliver you accessibility, quality, reliability and value. Working with you and making sure that your customers continue to get the best standards of care possible. At this point, I'll hand over to Rob Padwick, who will share with you the clinical direction in which he's taking Medequip. Thank you.
Thanks, Mark. Hello, everybody. My name is Rob Padwick. I am the Head of Clinical Services for Medequip. I have worked as an occupational therapist in health and in social services. I have an interesting introduction to why I became an occupational therapist. I was run over by a double-decker bus in 1998 and needed considerable input from a consultant orthopedic surgeon, a lovely occupational therapist, a physiotherapist, and a whole host of medical professionals that put me back together again. It took me a year to walk, but I decided from that point I was going to become an occupational therapist and do the best I possibly could at that role. So why have I joined Medequip? Why clinical services for Medequip? I joined Medequip because we are the largest service in the country delivering equipment into people's homes. Clinicians already prescribe equipment, just like myself, if another clinician prescribes equipment. They ask Medequip to go into people's homes to deliver items that make their lives easier. So why not ask the question, what more can Medequip do when we're in their home to provide them with greater independence and safety? How can Medequip reduce the stress for social services and hospital teams trying to do a better job under increasing pressures? How can we do it more efficiently and cheaper, and most importantly, whilst providing a better experience for the customer? Well, the background is not unsurprising. The true reality is adult services across the country repeatedly report that they are struggling with waiting lists. Customers who are vulnerable, less able, and require help with managing their daily needs experience delays, waiting to be seen by clinicians. There is increasing pressure on acute services to move patients through hospitals quickly. Equipment and packages of care need to be rapidly organised by discharge teams, working hard to get patients who need help and equipment home safely. Resources are stretched to a point where fewer hospitals are carrying out home visits, obviously because it costs money, and patients go home requiring instant follow-up from social services or other community teams to ensure their safety at home, or they're delayed in their discharge because the package of care is not ready on time. GP practices, health and social services departments continually work hard to provide high levels of service under increasing financial pressures. There is frequent overspend in both health and social services that needs to be taken control of. And of course, the elderly population, as we all know, is rapidly increasing. We're not going away. I almost included myself there, but the elderly population are not going away. Okay, what can we do to help? We can play a key role by providing clinical support to reduce the demands placed on all our services. We will reduce the cost, improve efficiency, and of course, most importantly, improve the customer experience. How? I am extremely excited to introduce to you the clinical support service that Medequip has to offer. When you have a customer who is struggling to live at home, beginning to lose their independence, and needing some help, advice with simple daily tasks, Medequip can help. We will take a referral from any health professional, or customers can refer themselves directly to us. We will respond to the referral by sending out a Medequip clinical assessor who will fully assess their needs, either in their homes or they can come to one of our assessment centres across the country. We will supply the customer all their equipment needs. We will fit all the equipment they need and then ensure they are safe and confident using it. Should they have more complex needs that we are unable to resolve, we're not going to try and resolve those ourselves, but we need to signpost them. We will refer them directly back to the social services initial prescriber that prescribed us to go there in the first place, or other medical health professional immediately. We will carry out full moving and handling assessments. We will review their equipment regularly, making sure it continues to meet their needs, and we will carry out regular tests on any electrical equipment, as Greg mentioned earlier. So what are our types of customers? In general terms, there are two major customer groups in the community teams are dealing with. There are complex, which take up roughly 20% nationally of our workload. They are the complex type of patients that need fully qualified, highly professionally trained occupational therapists and physiotherapists and other district nurses and medical teams to assess their needs. Then we have the non-complex cases, where 80% of our community workload is dealing with the simple cases. By providing clinical support in this particular area, the 80% area, we can reduce waiting lists, reach customers immediately, no delay at all, cut costs, and significantly improve customer experience. How can we work together to provide customers with a better service? Refer directly from your GP practices. Refer from your local hospitals. Ask your OTs and physios to refer to Medequip. All social service teams are able to refer directly for Medequip clinical assessors. Intermediate care teams and district nurses the same. In short, in general, people want to live in their homes. Medequip will support them wherever they are. Medequip clinical assessors are able to provide the right support for the vast majority of patients, enabling cost-effective assessment and clinical reviews of equipment in customers' homes. How is it more cost-effective? Because we are already in the customers' homes delivering equipment, there is no requirement to send out a separate therapist for that follow-up assessment. We are already there. Hence, the reason for the title of today's presentation, Bridging the Gap Between the Private and Public Sector. Now, the types of assessment that our Medequip clinical assessors can do are low-level, simple, minor assessments requiring non-complex intervention, 80% of the bulk of our work. The types of assessment I envisage we will cover are bathing, toileting, stair assessments, i.e. the second banister rail to help them up and down the stairs, bed, chair and toilet transfers, grab rails, and access to and from the property. Thank you very much for your time. I'm going to pass you back to Greg, who's going to close the presentation and open the floor to questions and answers.
You've got about 1 minute.
Any questions on anything you might have heard. Thank you all very much for coming. If anybody does have any questions or want to talk to us about anything you've heard or anything that Medequip do, we will be on stand N30 till the end of the day, so please come and have a chat. But if anybody does have any questions specifically for Rob or Mark now about the care home offering that we've spoken about or the clinical services, then now is the time.
I guess people were probably expecting something that was specifically related to people with dementia, as this is dementia workstream. Can you say a little bit about your clinical assessments? Do they include assessing people with dementia?
It would, I mean, our clinical services I envisage would include, right across the community. It's everybody within the community, so that includes people with dementia, those people caring for people with dementia. They are as likely to be on a waiting list as anyone else. So, yeah.
Okay, we've got time for one question if anybody's got anything they want to ask. Yes. Can you wait for the microphone, please? And
Hi there.
say who you are.
James Thompson at Metropolitan. Not that I'm saying you're untrustworthy in any way, shape or form, but you're going to be supplying the equipment and assessing how much equipment people need. Is that the proposal? No. Right. I misunderstood this.
That is the best question you could possibly ask, because it was asked to me earlier this morning. No, not at all. The original prescriber has assessed the need. We are going out there to deliver a piece of equipment or a few pieces of equipment. What we want to do is include a follow-up assessment during that visit. However, so in other words, we're not the initial prescriber of the equipment. We don't have a vested conflict of interest where we go with a van with loads of equipment and assess that we need everything in the van. You need to have it.
Because it is about saving money, I suppose.
It's absolutely about saving money. So good question, and thank you for asking it. But there is another side where, with a telephone assessment, certain areas across the country are doing telephone assessments for very, very basic, very non-complex need, which I think is a good thing. You can send us straight out there at that point and provide a simple one-off piece of equipment, and we'll assess its need and make sure it actually fits the need. So that's where the initial prescriber wouldn't be you, it would be us.
Would you, I know it's a follow-up question, sorry, just quick, would you be able to accept referrals from sort of third sector providers, such as sort of providers of housing or care and support? Domiciliary care, yeah.
Yeah, I think we are only as good as everybody else. So that's the thing. Being in the community as we are, we will be reliant on people like domiciliary carers, like you say, and other third sector providers. So yeah, we really want to work in tandem with those kind of people. Absolutely.
Thanks.
Okay, thank you. I think it's lunchtime, so if you'd like to show your appreciation, that would be good.
Thank you.
And
Please come and talk to us.
please make sure you take all your belongings with you, and if you can fill the feedback form in, that would be even better. Thanks very much.